Brought to you by CGTN Europe.
Hello, I'm Stephen Cole. Welcome to the Agenda podcast. In this week's episode, we're looking at $1 trillion global problem, addiction. It's thought that more than 250 million people worldwide are addicted to drugs or alcohol alone. But what drives them towards a potentially lethal habit? And what are the governments doing to try and cure addiction, stem the tide, in other words? First up, I spoke to Alexis Goosdeel, Director of the European Monitoring Centre for Drugs and Drug Addiction, about the changing nature of the problem in Europe.
I would say in few words that there has been a quite interesting evolution of the drug situation in the European Union over the last 5 to 8 years, I would say. What we observe today is an overall increase in the global production of any kind of drugs, which results in terms of impact on the European drug market in a high availability of any kinds of substances, but also a high level of purity and potency. And this is reflected, for instance, by the increase in the number of seizures that are made through large shipments that have been intercepted either in big ports in Europe or en route to Europe. To give you an example, we don't have yet the final figures for last year, but in 2018, there were 181 tons of cocaine seized in the European Union, and it was more in 2020. Just to give you an idea, a comparison, 30 years ago, when there was the start of the crack epidemic, it was 100 tons of cocaine. Today, only through the large shipments, it was 181 tons in 2018 for cocaine. But there were 668 tons of cannabis that have been seized, and heroin, around 10 tons of heroin seized, and for the first time through big shipments, mean containers too. So situation, the picture is threatening. There is a potential risk for the EU. And we also count that more or less 96 million of adults in the EU aged 15, 64 years old have tried an illicit drug in their lifetime. And we have 1.2 million of people, more or less, who are in treatment for a problem related to heavy or problematic drug use. So that's in a nutshell.
Alexis, these are very disturbing statistics indeed, but you talk about the number of seizures. What does that say to you about how much is getting through?
That's the £5 or $5 or €5 question. And I will disappoint you, I don't have the magic formula to give you the answer. But what we know is that through a convergence of different indicators, you rightly mentioned, I spoke only about seizures, but we analyze those data with other, and we cross them with other indicators, which show that there is an increase in the consumption of cocaine use in the EU. There is also, which is also quite worrying, some pockets of crack cocaine use that are appearing in Europe, which was not the case 5 years ago. Even though for crack users, the situation is a bit difficult to measure because as they are not really in treatment. What we have also observed is an increase in the number of demands for treatment of addiction issues related to cannabis, which can be related, partly at least, to the much higher concentration in THC that is found in cannabis. If you want a comparison, at the time of Woodstock Festival or May 68 events in Europe, the concentration in THC of that cannabis was probably between 4 and 6%. But today it can go up to 24%. And in some of the products that are produced in some states in the US that have legalized the recreational use of cannabis, you can find even e-liquids for vaping that contain up to 95% of THC.
How would you describe the impact on societies and economies in Europe of addiction?
Well, First thing to say is that the EU is the unique region in the world for more than 20 years that has designed collective strategies joining the efforts of the 28 and now 27 European member states together with the European Commission and European agencies like us, the European Drugs Agency and Europol, to develop strategies and develop joint efforts. And it gives results. It shows results. For instance, if you look at the dramatic decrease of the numbers of HIV and AIDS drug-related cases over the last 20-25 years, that's one of the excellent results of those joint efforts. If you see the increase in the availability of opioid substitution treatment that passed from 40,000 places in treatment in the early 90s to a total of around 650,000 people who are in treatment for opioid substitution treatment. It shows that the member states have made joint efforts and they have also developed and established a good response capacity, which is not the case in other regions in the world. Certainly, there is a concern and a close monitoring based on the work that we are doing, among others, and the member states coordinate their actions, and for that purpose, there is a special...
That is very good news that you have this policy and strategy, but is that strategy winning against addiction in Europe?
I think winning is not the exact term that we are seeking. I think if you want to eradicate, or if someone pretends to eradicate completely the drug problem, I think this is not the way we are looking at the things today if we want to be realistic. It's also important to be clear about having political objectives or policy objectives that are feasible. And the EU strategy on drugs that was recently adopted in December by all EU member states shows and is based on the results and the evaluation of the previous one. So yes, in Europe, in the European Union, we evaluate and we monitor the objectives and we record significant results. Now the situation is changing and is bringing new challenges. This is why we needed to regularly update the strategy. Now we are working on a new action plan for the next 5 years period.
Do you only lead a European initiative, or do you try and bring in other partners from around the world?
Well, first of all, we have, of course, our mandate covers the EU, but we are working very closely with the countries from Southeastern Europe, with also all the countries that are neighboring the EU, but more broadly with other regions of the world and with other international organizations. On the top of that, the EU has established a dialogue on drugs with some countries, and the last 22nd of January, for the first time, took place the EU-China dialogue on drugs.
And what did that involve, the EU-China dialogue?
But the topics that were discussed were starting first on the sharing information of the last trend on the drug situation, both in the European Union and in China. And on that specific point, I was asked to make a presentation on the EU situation. What was very interesting was to see that we shared the same challenges with China. In particular, the colleagues from China explained that they have a real concern with the increase and the rise of synthetic drugs and new psychoactive substances, as it is the case also for the European Union.
So China and the EU coming together in the war on drugs?
Yeah, they come together and at least establish a very high-level dialogue on those issues, acknowledging that there are differences in the policies and the strategies, but also there are common endeavors. And it was agreed that the dialogue will deepen, will continue, and the next annual meeting will take place, hopefully, in physical presence of all the participants next year in Brussels.
Alexis Goosdeel, many thanks to you for joining us on The Agenda. Well, we heard there about the EU's plans to cooperate with China to tackle the addiction issue. Let's get some more detail from China. I'm joined now by Shan Yehua, the Acting Director of the International Cooperation Division of the Office of China National Narcotics Control Commission. Shan, what kind of cooperation do you have with other countries and regions such as Europe?
As you know, China is one of the signatory countries to the 3 UN drug control conventions, and we are firmly supporting and actively participating in the international drug control efforts. We carried out all-round cooperation with our foreign counterparts. We have signed 47 bilateral cooperation documents with 38 foreign counterparts, including the European Union. As you know, we have signed the governmental agreement on precursor chemical control cooperation with the EU. And we have carried out international cooperations with the foreign counterparts in all aspects in the field of drug control. For example, we exchange drug control policies and strategies, and we share drug-related crime intelligence, and we carry out case cooperations, and we also share the best practices of drug demand reduction, and so on.
That's an amazing level of cooperation with so many countries and on so many different levels. But can you give me an example of how the cooperation works to help beat addiction?
As you know, China and EU, we just have launched the first China-EU drug control dialogue last month. And during that dialogue, we exchange drug control policies so that we can learn from each other the best practices taken back in both sides.
And how does China treat illegal drug users? Do you have any practical measures you can tell us to help them beat their addictions?
Yeah. According to the Chinese laws, drug addicts should receive treatment. And the Chinese government will provide services, including voluntary treatment, community-based treatment, community-based rehabilitation, and we also provide methadone maintenance treatment, which is called MMT, and which is commonly used in the world. I think the measures provided by the governments could help drug addicts to quit from drugs, because through those comprehensive measures, the drug addicts, they will get the assistance in physical detoxification, and also be helped in their psychological rehabilitations. And we also have some kinds of services in the re-employment for the drug addicts so that they can have a healthy and normal social life, which is also known as the reintegration back to the society.
In the European Union and in certainly Britain, we have a saying about prevention is better than cure. Would you agree with that?
Totally agree.
And how do you work to achieve that?
We think prevention is crucial in the drug control efforts. And in China, we have a national drug control law. And according to that law, the Chinese government has always taken the preventive education to the whole people as the most priority stage. That is the key strategy in our drug control efforts. We have carried out extensively publicity and education among the whole people, in particularly the youth. For example, in China, we have developed a online drug preventive education platform, in particular for the school students. After 2 years of running, this platform has attracted for more than 96 million students to register. And I think with our concrete efforts, the public awareness and the ability to refuse to say no to drugs has been promoted significantly. The number of newly discovered drug users in China has dropped down year by year.
Shan Yehua, many thanks to you for joining us on the agenda.
Thank you. It's my pleasure. Thank you.
Of course, as well as the economic cost, all forms of addiction take a huge personal and mental toll on millions of people around the world. Erin Khar is a former heroin addict and author of the book Strung Out, One Last Hit, and Other Lies That Nearly Killed Me. She joins me now from New York. Erin, in your book, you talk extremely candidly about your own struggles with drugs over years. How did you first become an addict?
You know, I like to tell people that I think for a lot of people who struggle with addiction, the addiction is there before the drugs come in. And what I mean by that is that, you know, there's certainly plenty of people who in their teenage years or in their early 20s experiment with drugs who don't become addicted. For me, this addiction started very early. At the age of 8, in the middle of a panic attack, which at the time I didn't know was a panic attack, I reached for a bottle of pills that was in our medicine cabinet. It had been there a long time. It was an expired bottle of painkillers, which I didn't know what they were at the time. I just knew that there was a label on there that said may cause drowsiness, and I wanted that drowsiness. So that was the first time that I reached for a drug. From that point forward, I would pilfer pills from the medicine cabinets of my friends' parents, from relatives. And when I was 13 and adolescence was hitting, I tried heroin for the first time with my boyfriend. And
you went on to become a full heroin addict. And
yes.
You obviously realized over the years that you had become addicted, and you tried to get clean several times. Why do you think it was so difficult for you to kick your habit?
You know, I think that it's difficult, especially for people who haven't struggled with addiction, to understand why you can't just say no, or if you have negative consequences continually, why you can't stop. I think there are a couple of reasons. Obviously, with opiates like heroin, there's a physical dependency that occurs, which while you're in active addiction drives the addiction. But you wonder why people keep relapsing. There is what I call a shame cycle that happens. And this doesn't just happen with addiction, but this happens with all sorts of sort of self-destructive behaviors, where we have these belief systems about ourselves that often are formed when we're very young, that we're not good enough, that if people really saw who we were, that they wouldn't love us. That's sort of that base primal fear that if people knew this X factor, they wouldn't love me. I had that from very early on.
You are, thank heavens, now very firmly clean. How did you kick your habits?
Well, as you in the book, as you know, and I speak about a lot, I relapsed. I don't even know how many times. I relapsed constantly. And I, at 28 years old, became pregnant, and it wasn't a planned pregnancy. Against all better judgment, I decided to have the baby, and I was using at the time. I found a doctor who was willing to detox me, because at the time what the protocol was to put pregnant women on methadone maintenance.
Yeah. There's a whole industry built up around the treatment of addiction and addicts. You talked a little earlier about the shame factor, and not enough perhaps is understood about the shame factor. Do we understand in 2021 enough about addiction?
No. I mean, of course, I think that there will still be more and more to uncover. That said, I think things are moving in the right direction. I think that globally, that there has been a shift in the way that public health policy addresses the issue and law enforcement addresses the issue. You've certainly seen this across Europe, and we're seeing this in the US now. I've sat on many panels with public health officials and law enforcement, and their policies have shifted away from punitive measures to helping people stay alive and access treatment. We still have a long way to go, but we're moving in the right direction.
The demographic for addiction has also changed dramatically. We've heard a fair few stories of young people, especially in the 60s, 70s, becoming addicted to drugs of various types. Today, the big problem is opioid addiction.
Yes.
And it's not necessarily young people, it's middle-aged people seeking fentanyl and prescriptions. And there's an opioid epidemic across America. That must be a very frightening epidemic.
I mean, it's very frightening. And part of the reason it's so frightening is that with these drugs like fentanyl, they're so much more potent than street heroin that people are dying at a much faster rate. You know, and I think that when we look at treating addiction and treating the opioid epidemic, the very first thing that we need to focus on is keeping people alive, because people aren't going to recover if they're dead, right? That's the number one priority, which is why things like Narcan training, that's the drug that's used to reverse an overdose, why Narcan training is so important. In most major cities in America, you can access Narcan without a prescription. I know many people who carry Narcan with them who are not struggling with addiction, but they do that in case they come across somebody who is in the middle of an overdose, which in a major city you often run into on the street. I've seen people recover from places that you thought they could never recover from.
But what surprises me, I think, Erin, is the demographic, that middle-aged people, middle-class people. You're not talking people living on the streets or disadvantaged people. You're talking quite well-off people for this opioid addiction. What has caused that?
You know, I think there's a combination of factors. I think one thing that we're not recognizing is that I think that there were more people like me when I was using drugs than we knew about. And, you know, a big part of the reason, you know, the first 10 years of my addiction, from 13 to 23, I hid it from nearly everybody in my life because I hid behind financial privilege. I hid behind being able, because of that financial privilege, I was attending prep schools. I went to a good college. I was a horseback rider. I had all these things sort of covering up what was going on. When pharmaceutical companies introduced new drugs like OxyContin to the market, and they were really promoted to doctors as being, you know, there was obviously we know about the lawsuits and the controversy that they were being promoted as being non-addictive and whatnot. There was a flood of opiates into the market that were finding their way to sort of like a new batch of people. But I think that we look at like, okay, so
you're saying this is really sort of a hidden epidemic.
Yeah, and I think that part of it is, you know, it's not just that they were prescribed an opiate. I think painkillers can be very effective. They're used to treat pain, but people who are struggling with addiction are using them to treat pain. They're using them to treat emotional pain. And it goes back to sort of, you know, this, what we talked about earlier in regards to shame and sort of long-term aftercare. I think that, you know, at the baseline of all of this is that we have globally a mental health system from country to country that is not very effective, and that we need to be looking at the mental health and well-being of people as equally important as their physical well-being.
That's a very good point. Erin Khar, many thanks indeed for joining us on The Agenda.
Thank you so much for having me.
And that brings us to the end of another edition of The Agenda podcast. Remember, you can subscribe to this podcast on iTunes, Stitcher and Spotify. You can also find us on CGTN Europe Facebook, Twitter, Instagram and YouTube. Until next week, goodbye.
The most interesting questions.
Are there other living beings beyond Earth?
Will man or machine be in charge?
Great question.
Always have more than one answer.
Well, hold on, let me just draw up a list.
And always come from more than one person.
That's where the credibility lies.
The concept of having a machinery which is alive and evolving didn't wait for us.
The end of inequality of incomes and wealth around the world, can you imagine how difficult that is at the moment to achieve?
Every episode, Stephen Cole, Murray Beveridge, and some of the brightest minds out there shed light on the answers to some of the most intriguing questions.
There are two ways of looking at this.
Machines can't really discriminate between civilian and military targets.
The Answers Project.
Maybe we need to just look at this in a bit more detail.
Extraordinary claims require extraordinary evidence.
The Answers Project, a new podcast from CGTN Europe.